And I believe that we have everyone on the call now, so we'll get right to it. Thank you for everybody for joining us today. We are excited to introduce you to the project management team and the project director, Paul Landry. And today we're going to talk a little bit about stage 2, where we're at, where we're headed, and then everyone will have a chance at the end to ask some questions. So with that, I will kick it over to David Moucher to kick us off.
Thank you, Allison, and welcome everybody. I'm David Moucher, President and CEO of Windsor Regional Hospital. I'm so excited to be talking to you today about hospital healthcare in Windsor, Essex, and it doesn't focus on COVID. Today, we're introducing our new Windsor, Essex, new acute care hospital project management team. So let us back up a bit. This is not only a mega hospital, but really a generational transformation project for Windsor, Essex that will reshape hospital healthcare for generations to come. It truly is exciting. It's going to be a ton of fun. And as stated, a generational transformation. Although there was a delay to get the stage 2 funded, we are thankful to the Ford government for making a promise in August of 2020 and delivering on his promise in 2021, all happening during a pandemic. This stage and stages to come is when the real work begins. We're excited to have the project management team here with us today. Mr. Paul Landry will introduce himself and the rest of the team. However, Windsor Regional Hospital is very pleased to have Paul step forward and want to lead this project. His experience with large teaching and research hospitals across Canada is extensive, and also a glimpse into what we're planning for Windsor, Essex. I can tell you that even before the Premier and the Minister of Health came to announce funding for stage 2, we were well under our way to hit the ground running, and hit the ground running we have. The 30+ user groups made up of clinical and non-clinical staff have already started meeting, with the unique feature of having patient representatives on them. Soon, the community will be hearing from each of our co-chairs of the user groups explaining what they're working on and asking the community to participate in focused town halls with the user groups. The last thing before I hand it over to Paul, I promise no COVID talk, but we have to mention it. One of the positive things coming from COVID is the now proven importance of Windsor Regional Hospital to not only the needs of our Windsor Essex community, but to our region, our province, and in fact, all of Canada. Throughout COVID, WRH accepted over 100 patients from the GTA, from the province of Ontario, and even across Canada. We will be one of the first hospitals being designed and built post-COVID. We will definitely benefit from all the learnings from COVID. One of the clear learnings is we desperately need a new acute care hospital for Windsor, Essex. With that, I hand it over to Paul.
Thank you, David. And first off, I guess thank you for attending this this media conference here to meet me and to meet members of the new project management team that will be leading the planning of this stage 2 planning process. So I'll introduce them in a minute, but maybe just say a few words about myself and a few words about what stage 2 under the ministry's 5-stage capital planning process is about. I won't repeat what I think most of you have probably already seen in the video introduction of me and the project and this stage 2, but I'll just say that I've been very fortunate and privileged really to have led some very large hospital capital development projects, as David pointed out, not quite from coast to coast, although that almost happened, but certainly Montreal and Vancouver and North Bay. In fact, I started my career on University Avenue in Toronto at the Toronto General in leading the planning of the Peter Monk Cardiac Center. And from there was recruited to my hometown of North Bay. At the time, Premier Mike Harris was the MPP for North Bay, and North Bay had been waiting over 20 years to develop a new hospital project there. And being fluently bilingual, I was fortunate enough to get recruited to the CHUM in Montreal, which is the University of Montreal Health Center, the Francophone flagship hospital of the province of Quebec, not to be confused with another acronym that is very similar, which is the MUHC. In fact, it has the same letters, but that stands for the McGill University Health Center. And I was then recruited to Vancouver to put a team together to develop the business case. It's a different process than the one here in Ontario. But that business case involved pretty much what we're doing in this stage 2, which is the development of a functional program and design documents and costing that then gets submitted to the Ministry of Health and ultimately was submitted to Treasury Board and received the green light of approval to move into the market for procurement, and that project is now underway. I recently, and I'm transitioning between a role that I'm providing right now for a new hospital up in Moosonee, almost at the other end of the province from north to south, to develop a new regional hospital. It's a small hospital, but it serves a very large region for the Winnebago Area Health Authority that will provide services for 6 First Nations communities in the lower James Bay coast. So I'm very pleased to be joining the Windsor Regional Hospital team to lead the planning of a new hospital and to help get it built. I think that Windsor has been waiting a long time for this project, and I've been on board for only a few weeks now, but it's a familiar sight to me. Amazing care in very limited environment, and certainly not the current standards of that we see in the new hospital builds, across the province. So I think that I'm quite excited to be joining the team and to be leading this process with the team. Stage 2, a few words on that. Stage 2 involves two main components. The first one is the development of a functional program, which is really a description of all of the clinical services and the support services that are required in the future facilities. It's all based on demographic projections, an analysis of current volumes and future volumes that are going to be required, staffing levels, but it's also, and very importantly, it's a list of spaces. It's a list of each and every room that will require in the new hospital. We're talking about thousands of rooms, obviously. And so it's a program list of rooms. Once we've completed that document, and that'll take approximately 6 months, we're just in the process of completing our first round of meetings, but there'll be 3 rounds of meetings with expert facility planners that we've brought on board that have planned similar new hospital projects across the province and beyond the province. Agnew Peckham healthcare planners from Toronto. Once that document is ready, it will be presented to architects that we will onboard this coming summer, and they will take that document and really be their roadmap of putting together the various departments. We call it the development of block schematic drawings. It's really the organization of blocks, both horizontally and vertically, and really looking at public access and public circulation and wayfinding and issues like that in terms of how to organize these blocks into a master building plan and of course a master site plan. And so the architects, that work will unfold in a similar fashion. There'll be user groups, the 50 user groups that David referred to, sort of almost evenly divided between clinical programs and support service groups that will work closely with the architects and our patients who are coming to the table in this next round to be a part of that whole process and to really influence, how we're putting how we're putting the blocks together, and all of the services that we're planning to have in the new hospital. Near the end of the year, that design information and all of the space listing and amounts of space will be reviewed by cost consultants, cost estimators, that will refresh the cost estimate, and the three components then of the functional program, the block schematic drawings, and the cost estimate will be submitted to the ministry by next spring. So having sort of given you a quick outline of the process for stage 2, I'm very pleased to announce the initial members of the project management team, starting with Dr. Andrew Petrakis, who will introduce himself in a moment. But when I met Andrew, I was so very pleased to learn of the number of years, and I'll let Andrew share that with you, because he's got a long history of involvement and in work at the Windsor Regional Hospital and leadership roles, and he can speak to that far better than I can. But he's very well, I think, recognized and appreciated by the nursing staff and the medical staff of the hospital. And he will be the director of clinical programs planning as we move forward through the planning process. I'm also very pleased to announce, to present Jeff Gemmell, who's the former director of the emergency department at Windsor Regional. And I know that he has managed some other clinical areas, and he can share a little bit more about that with you. But Jeff will be acting as the director of support services planning, all of what's behind all of these clinical areas to support their activities, like, of course, food services and materials management and pharmacy and the laboratory, and I could go on, but there's a long list of over 20 of them that are under Jeff's purview of responsibility to support the leadership of each of those groups and the teams that will be advancing the planning for those areas. And we have Allison Johnson, who I think most of you are familiar with, who has assumed the role of manager of communications and community engagement, and she'll say a few words as well. But I just want to highlight that one of the things that really attracted me to this project was the extent and the progressiveness of onboarding patients this early on in the process, which I think is fantastic, to get that patient lens and that patient perspective in the project right from the beginning. And so we have, I think, a very progressive plan of involving those patients, but also reaching out to the community on a very regular basis, through our community engagement plans. So I think I'll stop there, and I may ask Dr. Petrakis to say a few words. And once we're done the introductions, we'll of course be ready to take your questions and answer to the best of our abilities. Andrew, would you like to say hello and a few words?
Great. Thanks a lot, Paul, for the kind words. Good afternoon, everyone. I'm Andrew Petrakis, and I'm the Clinical Programs Director for the Stage 2 Functional Planning for the new acute care hospital. In terms of background, I was born and raised in Windsor. I completed my medical school training and surgical training in London, and I've been a general surgeon in Windsor since 1984. Over the past 38 years, I've been in a variety of administrative positions. Just to outline a few of them, I was past president of medical staff and chief of staff at Metropolitan Hospital in the early 1990s. I was the academic director for undergrad and postgrad surgery for SWOMEN, the Southwestern Ontario Medical Education Network, and Schulich School of Medicine Windsor program between 2002 and 2015. I'm currently a medical advisor for the Standardization and Optimization Program project since 2014, when Windsor acquired acute care in both the Metropolitan and Willette sites. The aim of this project was to standardize medical care according to best practice across both campuses, so that when we did move to the new hospital, we'd be on the same page from both campuses, two medical staffs going to the same hospital. As well, since 2017, I've been the medical advisor for the Cerner project, the health information services that was implemented at Windsor Regional Hospital in April of 2021. And finally, I am currently still the medical advisor for Choosing Wisely Canada, which was started in 2018, and we attained our level 1 certification back in October of 2019. And just to remind everyone, I'm currently the clinical programs director, beginning in January of 2022. And just on a personal note, I just want to say I cannot think of a more fulfilling way of rounding out my professional medical career in my home community than being able to provide assistance in planning for our new acute care hospital. Thanks. And I'll turn it over to Jeff now.
Thanks, Dr. Petrakis. It's a tough list to follow, and thanks, Paul, for your words as well. So I am Jeff Gemmell, and my academic background is in public health. I have a master's degree in public health and certifications in project management. I did that work previously before returning to Windsor Regional Hospital about 8 years ago. And during the last 8 or so years, I've held a variety of clinical leadership positions across the organization in departments such as surgery, medicine, and as Paul mentioned, most recently as Director of Emergency Services, before moving into this role as Director of Support Service Planning. And in this new role, I'll have the opportunity to work with many of our support service departments, which Paul mentioned a few, like food service, environmental services, lab, diagnostic imaging, pharmacy. There's so many great services to work with. And help guide and support them through their planning process and their functional program submission for stage 2. And as Dr. Petrakis said, I too am born and raised in Windsor, and it's very exciting to be a part of such a historic project and planning for that in the city. So looking forward to working with everyone.
Allison, would you like to say hello? I think you know everyone, but please maybe speak a little bit about your role.
Happy to. I think I do know most people on the call today, having worked in media for 14 years before joining Windsor Regional Hospital. And many of you may have been at a news conference with me about 9 years ago when the two hospitals, Hotel Dieu Grace and Windsor Regional, were announcing plans for a realignment of services and introducing the future vision of the hospital that has led us to where we are today. And I remember being at that news conference and getting like physically excited about what was being announced. Because if you remember at the time, we had been covering plant closures and people leaving Windsor and going to work elsewhere because they couldn't find anything here. So to hear about this opportunity to bring state-of-the-art healthcare to the area, to build a facility that suits the needs of this area, that can transform hospital care that we know to what we've been covering in areas across the province, I was thrilled, and then thrilled shortly later after that to have the opportunity to join this team and work to support this project. It's been a little bit quiet lately on the project front, so super excited to now being able to start talking about stage 2. And the steering committee in stage 1 was committed to making sure that we had patients and community members at the table through it all, that we were touching base, keeping people informed and inviting feedback at every opportunity. And that commitment is only stronger in this phase for sure. So Paul mentioned we are inviting patients from some of our user groups to the table to be part of these user groups from our patient and family advisory committees. Over the course of the next couple of months, we're going to introduce you to members of the team, share what's happening in each of the groups that Jeff and Dr. Petrakis are working with, along with Paul and the team at Agnew Peckham Health. And also, we're going to be leading all up to 2 town halls and inviting public feedback through a series of surveys so that we make sure that we're continuing to bring that patient and community voice to the table. I hope that everybody is as excited as I was 9 years ago and still am right now about this project. And I hope that everyone finds a piece of the project that they can support and get involved in. It's happening, and we're thrilled to be here. I'm thrilled to be part of this team now put together. And before I turn it back over to Paul, I just want to recognize 2 other people who are with us today. Fatima Lopes-Burrows, who's providing administrative support, and Hope Monaco, who is from the University of Windsor as an intern who's working with us to support this project for the next few months. So with that, I will turn it back over to Paul.
Thank you, Allison, and thank you, Jeff and Andrew. And I think now we're ready to field your questions and provide the answers. You may. So, and Allison, did you just want to do this by a show of hands? I'm not sure that I can see them all, but
no, I think we'll go around. I've got a list here of participants on the side, so I'll go by order of what I see. Again, everyone will have the opportunity to ask a question and a follow-up, and if there's time at the end and you still have further questions, let me know in the chat, and if there's time, we'll go back around. So first up on my screen here is Elvis from CBC French.
Bonjour, Monsieur Landry.
Bonjour. Comment
vous avez dit
allez-vous?
vous avez dit que vous parlez français, ça tombe bien, ça ne nous arrive pas tous les jours, merci. Alors, je voudrais commencer par vous demander où en est le projet, au moment où vous le reprenez, où est-ce qu'on en est, qu'est-ce qui reste à faire, combien de temps est-ce que ça prendra?
Oui, bien, merci beaucoup pour votre question. Puis, je dois avouer que ça fait maintenant déjà quelques années depuis que j'ai travaillé en français, mais c'est fantastique que je vais avoir cette opportunité dans la région de Windsor avec une population francophone. Donc, où nous en sommes présentement, c'est disons, à la 2e étape de 5 étapes en place par le ministère de la Santé en Ontario pour le développement de centres hospitaliers, soit la planification et éventuellement la construction. Donc, nous sommes à la 2e étape qui comprend le développement d'un programme fonctionnel que j'ai décrit, disons, tantôt, là, qui est vraiment un écrit de, disons, la description de chacun des services cliniques et tous les services de support qui sont bien décrits par rapport à leur fonctionnement, mais qui sont planifiés par rapport à leur volume présent, puis planifiés pour le futur, ainsi que tout le personnel requis pour livrer les services dans chacun de ces services. La 2e étape, ou la 2e partie, dirais-je, dans la 2e étape de cette planification, c'est le développement de dessins schématiques pour vraiment mettre les blocs, on pourrait dire, de chaque département dans une organisation à la fois horizontale, mais aussi verticale, pour développer ce qu'on appelle un plan maîtrise du bâtiment lui-même, mais aussi pour l'ensemble du site. Donc, c'est la 2e étape. La 3e étape sera à avancer ces plans plutôt schématiques dans des plans beaucoup plus détaillés et avec le développeur qui sera avec nous par cette étape-là pour vraiment avoir la perspective de la construction pour influencer le design que nous allons avancer avec. Par la suite, il y aurait une étape de procuration dans le marché pour sécuriser les services d'un contracteur et avancer à la 5e étape qui sera la construction du nouveau centre hospitalier. J'espère que cela vous donne une idée de où nous en sommes et dans cette 2e étape du projet.
Merci, Monsieur Landry. Allison, do I have the right to follow up?
Yes.
OK, thank you. Alors, oui, Monsieur Landry, je voudrais savoir, est-ce que vous pensez, vous vous attendez à rencontrer des défis en particulier? Et puis, quand est-ce que l'hôpital, vous pensez, sera prêt à ouvrir? Ou du moins, est-ce que vous pensez qu'il sera prêt à ouvrir selon l'échéancier qui avait été prévu au départ?
Oui, ben, je ne commenterai pas sur l'échéancier qui a été prévu au départ. Je veux dire, avec ces projets, il y a toujours les étapes de soumission, mais il y a la période de revue du ministère de la Santé entre chacune des étapes. Et cela, ce n'est pas un échéancier que nous contrôlons. Et ça dépend beaucoup des commentaires que le ministère nous présente et qui nous challenge au point de vue de répondre comment nous avons mis certains plans en place et certains volumes que nous avons planifiés, etc. Cela étant dit, nous avons développé ce qu'on appelle vraiment un échéancier global pour le projet. Et si tout va bien et si nous pouvons avoir des réponses, disons, ponctuelles dans un assez court délai, mais on parle quand même de plusieurs mois entre chacune des étapes, nous voudrions mettre l'appel dans le sol dans 4 ans et demi. Donc, nous espérons par l'été de 2026. Et puis, pour l'autre portion de votre question, ce que j'entrevois, disons, de défis uniques ici, je répondrais que non, vraiment. Je suis très encouragé avec, disons, la vision et la stratégie de l'hôpital de vraiment tendre la main et d'impliquer les patients dans toute la planification et vraiment d'engager la communauté, et je dis la communauté large, dans la planification de ce nouveau centre hospitalier qui est tellement longuement attendu par la région et qui est tellement important pour la région. Donc, c'est vraiment un projet fort intéressant et ça me fait plaisir d'en faire partie.
OK, merci, Monsieur Landry. Thank you, Allison.
Thank you. Next, we have John Lewis from CTV.
Thanks. Sorry, I just wanted to unmute myself. Just wondering, how would you compare this project to some of the other projects that you've worked on?
Well, thank you for that question, John. Well, first off, to echo, what David Moucher, said at the outset, this is truly a mega project. This is a very large, hospital development project, sometimes referred to as, as a regional, hospital project, but a hospital that will be, in excess of 600 beds, with a very large surgical program and large intensive care unit beds and coronary care unit beds. It is a very large project, a large undertaking. As it compares to others, the SHUM was, a university health center project with 772 beds. The new St. Paul's project that's now underway is in the vicinity of 475 beds. So, it's certainly in the range of these large, mega hospital projects. The two others are, the two that I've mentioned are, university health center project with, full-fledged, medical school roles and research roles. That's not the case here, but it is a very, it is a very large regional hospital development.
Do you see it becoming, though, eventually maybe a teaching hospital in some ways with a connection with the university, possibly someday down the road?
Someday down the road, I guess we never close the doors to things that we don't, that we don't know today. But I will say from you know, the short amount of time that I've been here, that I'm getting to appreciate the importance of, you know, the education role at Windsor Regional Hospital and all of the teaching that goes on, you know, from a nursing perspective, on also the affiliation with the Western University School of Medicine, the Schulich School, and so there's a very important role on the academic education side that needs to be built into, you know, all of our planning. You don't, you know, round on an inpatient unit with a group of 4, 5, 6, you know, interns or nursing students without having sufficient touchdown space to then be discussing, you know, cases in a confidential environment. You can't do that if you don't plan for the space. So it's going to be very important that we do that. And there's already, you know, I think I will call it a burgeoning group of researchers that are starting to, you know, look to the future in terms of research programs, you know, that they can see coming down the road. And I'm quite impressed with some of the young medical leadership, you know, at Windsor Regional Hospital. And so I can see that, you know, growing in the future. I would say that we're very fortunate to have such a great site, a nice large greenfield site that'll allow us to, you know, grow the hospital in the future and to add, you know, other components, you know, onto that site as may be required in partnership with other institutions, with other organizations. I don't know if Dr. Petrakis wants to add to that. He's been involved in education level a lot longer than I have.
Yeah, absolutely. When we started back in 2002, I can remember the day that we initiated our program. We started with 7 full-time clerks doing the third-year medical students doing the rotations from University of Western Ontario. The program has expanded. The medical school Windsor program, part of Schulich Medicine, came on board in 2007, and we are currently up to 37 full-time medical students at the university as part of the Windsor program. The residency program has gradually expanded. There are currently 10 residents in each of the 2 years of family medicine. There are a couple of psychiatry residents in each year of the psychiatry program as part of Schulich Medicine. We have a continuous rotation of medical residents through the clinical teaching units of internal medicine. We have surgical residents coming through, neurosurgical, vascular, and general surgery residents, including as well as plastics residents coming through the rotations. As well as part of our user groups, we have Schulich Medicine represented by Larry Jacobs, the Associate Dean of the Windsor program. We also have an education and research sub-user group that will all have input into the spaces that we require in the future.
Thank you very much.
Thank you.
Next, we have Dave Waddell from the Windsor Star. Dave, you're on mute.
Yes, I was probably Dr. Petrakis might be best suited to answer this question. I know you're being charged with forecasting the services that we're going to need out 20 years, like 2040, just to round it off. Based upon what you know already of the hospital, what are the services do you see that you're currently offering that need to be expanded, and what complementary new services are you anticipating that we'll need in the new hospital?
Yeah, it's actually amazing looking at the age and demographic projections for our region and the services that we'll need to provide the best care possible in the future. We're looking, I'll give you a specific example of cancer care. There are a whole variety of modality of new treatments that are coming online. Example, CyberKnife and Gamma Knife therapy that will be included within the cancer clinic program. As well, we've already obtained consensus to place an operating room in the radiotherapy area to provide cancer care, continuous cancer care for those patients that need it, and allow them to keep their care within the cancer center as much as possible. This is providing best patient care. Emergency services will be expanding based on population growth. Same as for, we'll say for the obstetrical unit, those beds will be increasing. Almost every service that we provide will have a bed expansion related to population and age projection growth.
Okay. Alrighty. Just when the in planning this, I know you have like a wish list, and I know there's no budget at this point. Services and space requirements to deliver those services will determine the final budget. So how do you go about planning for new services when you know they haven't necessarily been approved yet, your request being approved yet by the ministry? I was just wondering how you start to approach that.
Well, perhaps I'll give a first answer to that, and then Dr. Petrakis could add to it. I mentioned, onboarding, expert facility planners with us, they being Agnew Peckham, and they have planned many new hospital projects. And so what happens, Dave, is that, what those projects have planned, and when we're looking at, how many ORs we're going to need, or how many examination rooms you need in a particular clinic area, or how many beds you need, it's all driven by volumes. And so we know what our current volumes are, and what we need to do is extrapolate to the future. And the ministry's role will be to look at what that extrapolation and that planning is, and how much we're asking for. I never refer to it as a wish list, but we will push as far as we believe we need to go in terms of having, the adequate space and rooms to deliver the services that are forecasted into the future. But having said that, the ministry will always compare us to, the volumes and number of rooms to deliver those services in other new comparable projects, whether that's, the new hospital in Vaughan or Humber River in Toronto, the new hospital in Ottawa that is being planned. So there's a lot of comparison that goes on, between hospitals, and really looking at, what we're proposing to deliver. I mean, it really gets down to, how much time are we forecasting for a particular type of patient visit in a particular type of room. So it's pretty scientific, and out of that comes this conclusion of we need X number of that type of room in a particular service area. So it's very much planned out that way, and the ministry does this comparison between what we're forecasting and what we're asking for, and what they've approved in other projects. And quite frankly, they're always monitoring that, post-construction, to see how those volumes are being responded to, and how well the hospital is providing, the services across all of those clinical areas. I don't know if Dr. Petrakis would want to add any.
Just a couple of things. I mean, we have physicians, medical talent that have specific abilities that are left untapped because we don't have the actual facilities currently. An example is endoscopic upper GI endoscopy, and EUS, endoscopic ultrasound. We have several new physicians in town who are capable of carrying out this particular procedure, but we don't have the equipment, and that's been part of the plan to acquire this equipment so that we can expand our capabilities here in town. As well, they say if you build it, they will come. We'll attract talent when we have the new acute care hospital for things that we're just starting to plan for right at the moment.
Okay, thank you.
Thanks, Dave. Next, Jason Vio from CBC.
All right, thank you. I'm not sure who is best to answer this, but I'll just throw it out there. How will the current pandemic, do you think, shape the future of the hospital? And has anything been learned during COVID that would perhaps make this new hospital more equipped or better equipped for future outbreaks or pandemics?
That's a great question, and obviously a very timely one. And I'll respond to it firstly, and I'm sure that David could probably respond to it best, because he's really been on the front line of of the hospital's capacity to respond in this pandemic, and of course to COVID. But as he mentioned at the outset, we will be one of the first hospitals to be built post the pandemic, and the ministry, ourselves as well as the ministry, have really learned a lot about how we need to flex to respond to sudden airborne disease, like COVID. So in areas in particular, like the ICU, we really have to plan future capacity of the ICU. We may, in fact, and it's an expectation of the ministry, that we would actually build some rooms for the future that are planned as part of our longer term volume projections out to 2038, but that will provide us this flex capacity should we need those additional beds, to surge into in response to, perhaps a future pandemic. And it's not just the ICUs, but it will also be the inpatient units to be planning for some additional beds that will actually be fitted out, fully equipped and ready to open up should we need to. And in fact, some of the new hospitals have even shelled in a complete floor to add 2 inpatient units, or space for 2 inpatient units. And then of course we could proceed with fitting them out, constructing the rooms and equipping all of the rooms in a much shorter period of time than if we were to try to add another floor on top of the hospital. So the ministry is really, together with all the hospitals, learned a lot through the challenges and the stresses that the system has undergone, through this pandemic. And we would really be remiss if, in planning a new hospital, we didn't plan for that kind of flex and surge capacity. David, if you wanted to add something else to that.
Yeah, definitely, Paul. I mean, Jason, the goal is, as we move forward, we don't want to have to open up, quote, field hospitals. We don't want tarps and duct tape as being the way we provide care. And that's what the new hospital brings, and the opportunity. So aside from just that, as Paul indicated, you want to create your space within the existing facilities. So if you do need to ramp up, the space is on site. Other new hospitals had that opportunity to do that. We, of course, did not. We had to go to a field hospital to make that happen. Again, being one of the first hospitals out of COVID to be built, we can take advantage of that. And just to put it in perspective, the state of Michigan has 40% less population than the province of Ontario. Yet they have 40% more critical care beds than the province of Ontario does. This has an opportunity to fix that. Ourselves, along with a couple other projects in the province, are the first out of the gate post-COVID. We got to fix that, and we got to take advantage of that. And as stated, Windsor Regional Hospital played a very important role, and continues to do so, during COVID, with respect to helping out not only the rest of the province, technically all of Canada. So if we had the physical space to take more critical care patients, or even more medicine patients in wave 3, we would have. We just didn't have the space. So that was the issue. So again, it's a great opportunity. And, there's all talk, we've been talking about this for 9 years. Just one issue you hit on is beds. As everyone gets lost in the number of beds, and how many beds are you going to have? You're going to have, that is a work in progress. We've said that from the start, we're not going to have less beds than we have now. What that magic number will be, it'll be. But it's definitely going to be a lot more than we have now. They're not going to be crammed in spaces that are not technically meant for patient care that we're having to use now. So that is what stage 2 and what we kept talking about, where the rubber hits the road, where all those questions are going to be answered. But if someone wants to lay a bet, I'll more than glad take it, is we're definitely going to have more beds we have now as we move towards the new hospital, and even then some. So let's just go through the process and get the work done. And then we'll have those numbers, and they're going to continue to morph before we stick a shovel in the ground. And the same with the overall pricing of this project. We don't know what it is. We haven't gone to market. So when we go to market, we'll figure it out. Right now, the government clearly in their documents indicates it's greater than 1 billion. We threw around 2 billion as early cost estimates. That's going to change too, depending on a whole bunch of issues. So that's to be seen as we move forward with respect to this project. How many square feet? Right now, we got about 800,000 square feet between the two campuses. It's going to be a heck of a lot more than that. Paul, the range, who knows? 1.4 million square feet is probably going to be a conservative estimate. I can tell you we were on a call this morning. The issue of space and beds are all live issues that are active discussions with the ministry as we speak. But we got to get through this process to nail that down. So, but again, it's generational transformation, and that's what we're looking at.
Okay. And then my only other question, obviously very early in the process, stage 2 of 5 being construction. Do we have any sort of rough estimates or timeline commitments, shovel in the ground, when you want this thing open by? Do we have a sense of that? Anyone on the team?
Sure.
We went open by yesterday, but Paul will explain the timeline.
Sure. Actually, I answered that similar question in French. So I'm chuckling a little bit, but we, kidding aside, we developed very early on in my arrival here, a project timeline, really a global project timeline, looking at each of these phases and being, I think, conservative, being reasonable, but still a bit aggressive. What we can't control are the periods of time, after we make a major document submission to the ministry. So at the end of this stage 2, we submit to the ministry. Now, it's not going to be a surprise to the ministry. We're having regular meetings with them, and we're reviewing, a whole host of forecast issues and planning issues, with them. So, but what we've identified in our overall timeline is what I will call the reasonable review period by the ministry. And if we can get the green light to then move into the next phase, and then after phase 3, move in fairly quickly into phase 4, and then getting the shovel in the ground, we've extrapolated that out and developed a project timeline that would see us getting the shovel in the ground in approximately 4.5 years. So hopefully by the summer of 2026, and when I mapped it all out and showed David and the leadership, they said, yeah, that's kind of pretty close to what we were thinking. So that's kind of the timeline that we're working to right now. Obviously, if we can shorten that, we certainly will. There's a change in procurement process happening across the province, a different approach to the P3 type projects, and onboarding a developer much earlier on with us, that brings a design team to help work with our design team, so that they can start planning the construction well in advance, and helping us adjust issues in the overall plans. And I believe that that's a recipe for accelerating things, because I think we all know in a very large project like this, time is money. In fact, time is big money. And the sooner that we can get it, into construction and underway, then the better off I think we will be from a total cost perspective.
Okay, thank you.
Shelby from the Harrow Times.
Hi there, Shelby Y, Herald News. So we talk about the ministry determining funding by comparison. That's what you were saying earlier. But being a post-COVID build, it kind of sounds like it's comparing apples to oranges. Is the expectation that this hospital can negotiate for more dollars in the budget to accommodate for kind of pandemic proofing the new build? Or is that totally, in the air right now?
Well, I think that, when it comes to what we're forecasting in terms of service growth, that is, even without, any pandemic, considerations, that's where the comparison comes into, planning of other, recent new hospital projects. So, from my perspective, what we're asking for is nothing more, but nothing less than, what other, new builds have been able to, achieve with the ministry and of course with the government. And I might say, having been through this process, and on several large projects, I can assure you the ministry wants to do, the best for every region, right? They want to plan out the services that are going to be required, well into the future. But then along comes a pandemic and stresses, the system, stresses the hospital, as has been pointed out, to the limit and beyond. And as David, has pointed out, has forced, some hospitals to develop field hospitals, out in the parking lot and, in a tent type structure. And we have an opportunity here to shell in some space and to have it available to convert very quickly into active beds. So I think the answer to your question is that we are planning, to propose that, but quite frankly, the ministry is expecting it. There's an opportunity here to build a new hospital that will have surge capacity. And I think what we are thinking of doing and what we're planning to do is very much what the ministry is planning for as well and wants us to do. But as David pointed out, there's a lot of number crunching and there's a lot of details that go into, the bed counts, across different services, whether it's the ICU or it's inpatient beds. And so that's what we're engaged in right now is this programming of our volumes and the number of rooms and beds required.
Perfect. Thank you so much. That's it from me.
Thank you.
Thank you. Rob Hindi, AM 800.
I know Allison touched on this in her opening remarks, just in regards to the public and public engagement. So I guess for this stage, what's the goal for the public? What do you want to hear, or what will the public be asked?
Allison, did you want to maybe respond to that? You are our expert in this area of communications and community engagement. Know the plan far better than any of us, I think.
Happy to. And I will say that even early on, even before we started these user group meetings, we did go out to the public and ask, what's your vision for the future design of this hospital? What's the priority that you want to see? And that was back in November, December. And we had close to 1,000 replies to that. And it was a really rich batch of replies covering so many different topics. And from there, we put together a project vision and design principles that will guide the decision-making throughout this stage and right through construction of the project. And what was interesting is that those design principles are similar to what other hospitals have used, but it all came from the community. So we're already starting out on a very similar page, but now we've got the community's vision baked into ours right from the get-go. And as we go forward and we talk about these user groups that are meeting to talk about really, fine details about the project. Number one, we have, like I said, patients from some of our patient committees sitting at those tables, but we're also going to go out and have a series of town halls later this spring, where each of these user groups or some combinations of these user groups will talk very specifically about what would you like to see in terms of the design of cancer care? What would be the ideal experience? How can we take the hospital and design it to give you that experience? And what are the current barriers that exist in the current design that we can work to make different going forward? So that's just one area. Like I said, there will be other areas. We'll talk about inpatient units. What would you like to see in the design of a room so that patients and families families can have the best possible experience? What would you like to see in the emergency department? So really, we'll have the town halls. We'll hear from the user group leaders to talk about the work that they've been doing, but then we're also going to ask for feedback to help inform those decisions before the final functional program is put together.
Thank you. One final one. Paul, you mentioned, just going back to Jason's question about shovel in the ground, you mentioned the goal is 4.5 years. So for this stage right now, what's the timelines for this particular stage?
Yeah, this particular stage will develop the functional program by mid-June. The architects will be onboarded by that time. That's our goal. And the following 6 months will be to develop the block schematic drawings, the arrangement of all of the departments. We call them blocks. You know, they could be square, they could be rectangular. You know, it needs to fit into this puzzle of what will become, I think, a very exciting master building plan. And near the end of that process, in end of November, December, we'll onboard the cost estimators to look at all of the space and the building and how it's all put together to refresh the cost estimate, and then submit the document, which is the stage 2 submission to the ministry by next spring. So we're targeting the month of March. So roughly we're looking at 14-15 months for this particular phase of planning.
Thank you.
Maureen Rive, Blackburn.
Hello, I think most of the questions have been asked and answered. I guess just leading off of some of Dave's questions about funding and the services that you want there. At this stage, do you ask for ultimately exactly what you want and hope you get it? Or do you know, based on the other hospitals that you've done, that this is reasonably what the province will fund for a hospital in our region of our size?
Yeah, that's an excellent question, Maureen. And, my response would be we will plan for what we need in terms of the forecasted need, well into the future. And we will present that to the ministry, and we will defend, if you will, all of that analysis that leads us to the final program of space. And we will then let the cost come back to reflect what what this new hospital will cost. It's not driven the other way around. Here's a maximum budget and build what you can, because if that were the case, we might not be able to build the services that we're forecasting will be needed in the region. Through that process is always this comparison of other projects that have recently come before us, and we're going to be looking at those and researching those. There's obviously sharing of information that should and does happen across this area of new hospital planning. And so, like I said earlier, we're not going to plan for a wish list of things, or trying to get that much more for ourselves. That's not really what this is about. It's not about getting more, but it's also definitely not about getting less, or not planning for sufficient services to serve the needs of the population into the future. But it's fairly scientific, and I think that once all of that information is presented into a program, the ministry does this comparison, as I mentioned earlier, and things are not like you have to arm wrestle over what it ought to be. The facts are the facts, and the ministry is able to respond to that and say, yes, we agree. This is the scope of the program in the future, and this is what the size of that department and this hospital should be.
We're also hoping that the patient input will have a great impact on what the ministry considers as necessary services in the area.
And I guess just to build on that, I mean, the funding not only for the building envelope, but also for the operational costs after that, is that part of this planning process? And if you do want to expand services in a certain area or offer different things, is this approved through that process, or is that process later?
Well, that's a very good question. And in fact, as we're presenting this information to the ministry by way of a program and all of the forecasted volumes, the ministry, and of course, we're looking at, our current staffing complements to deliver, certain volumes across, all services. And the ministry, of course, knows that, as we, need to expand services, into the future, that we will need to adjust, our staffing to be able to deliver those services. So what happens much later on, Maureen, and actually during the construction phase, when you're sort of at 2 years from substantial completion, we're working on, an operational readiness plan to train the necessary staff in all of the new equipment in the new facility and prepare for, the move into the new facility. But in parallel to that will be the development of the operating plans and the forecasted operating budget for year one. So that you're right, that conversation and that planning happens, later on in the life cycle of the project. But the ministry will be obviously very involved in that. We certainly don't want to build the capacity and then we can't operate it.
Thank you.
Kyle Horner, do you have any questions, AM 800? Hearing none. We also have a CBC News Windsor here, and I'm not sure who this is and if you have any questions. And that sounds like a no. Does anyone have any further questions? I think we've covered it all. I will toss it over to David for a final word here, but thank you everyone for your time today. And if you do have any further questions, we look forward to speaking with you throughout the process, and you know where to find us if you do have any further questions. David?
Thanks, Allison. Again, thank you everybody for attending today. And again, so glad we talked about something other than COVID primarily. COVID did find its way into the conversation, but only the positive things coming out of COVID we were able to focus on. So it's an exciting time, a ton of work. If you could just, in your messaging to the community, help us, is for them to hear from us. They're going to see it in different fashions, be it social media, our internet site. We're going to try to reach out in different ways through community groups to get them involved and get them engaged as the user groups start going out to the community, and they're going to hear from the co-chairs. Each user group's going to have town halls. If you're interested in critical care, you can join that town hall. If you're interested in cancer, you can join that town hall and you can participate. You can provide feedback. You can get the information and be involved. And it'll be very interactive from that point of view, as well as other ways to get the community involved. We pride ourselves on community engagement. We're breaking the mold. As Paul stated, this is something different, and we're not stuck with what others have done with respect to community engagement. So we're breaking the mold on that. It's going to be exciting. So again, and if someone's interested in all of it, they can join all of it and be part of all of it or parts of it. So again, I really want to thank Paul, Jeff, Andrew, the whole team, Allison, Fatima, and Hope. Being part of this is some excitement that's coming forward for Windsor, Essex. And as we already stated, we hit the ground running already. And you're going to hear more and more about this over the next few weeks into the future. So again, thank you, everybody, and look forward to this. It's exciting.